I'm Maria Baldino. I'm a board-certified pediatric occupational therapist, and I'm the founder of The Happy Start. The Happy Start is a business that offers private, individualized teaching sessions for parents to help them better understand their child's developmental milestones and their developmental growth. Whether that means you have a new infant and you are wondering how to help them engage in tummy time, whether you have an infant that's having trouble taking a bottle or having trouble transitioning from that bottle to solid foods, or if you're just nervous about giving your child solid foods, that's where we come in to help. So the Happy Start has two focus areas. The first one we call the first and the second year, and this is for parents of children who are young infants, or even if you're expecting, so anywhere from a young infant to 12 months of age, and then also that second year of life, so 12 months to 24 months. And here we're really looking to help you understand your child's own unique developmental milestone journey, and to help you understand ways to engage with your child at home and in the community to help them meet their milestones. The other focus area of the Happy Start is preschool or kindergarten readiness. So we know right now in the current world, our parents are being asked to do a lot more than they ever have before when it comes to schooling or academic skills at home. And also we know that our children are being asked to do a lot more. In this focus area of the Happy Start, we will help you and your child learn pre-writing skills, and we'll help them learn things like letter formation to give them a good start so that when they start kindergarten and they go on and on and on, they're making their letters in a way that's going to be efficient for them. And when they start writing paragraphs down the line, their hand's not going to get tired. We're going to help you understand self-regulation for these kiddos, to help you and your child have a better way to communicate how they're feeling, and give you some tools and strategies to help them calm their bodies down, or give you some tools and strategies to help them maintain their attention to a task. So the idea for the Happy Start actually started about 5 years ago. I was working in early intervention with a family that had twins, and we were initially just working on feeding when they were very, very young infants, and they met that goal and were doing great. And I continued to come to the house for the year every week and would just help mom and dad understand what their child was currently doing, where they were going next, and how I could help them get there. And one day I came over to the house and mom was telling me about a play date they had just gone on with a family that had children of similar ages. And they were playing on the floor in a family room, and mom helped her little one go from crawling up to standing at an object. And she put her hands on her hips in a way that I had taught her that would facilitate that movement. And her friend said, "How'd you know how to do that?" And she was like, "Well, Maria comes to my house." And she told me that her friend said, "Well, that's not fair." And I had this moment that I realized more often than not, parents and families do not have access to a pediatric occupational therapist or a developmental specialist unless that family has already experienced some sort of developmental delay, they've received a diagnosis, or they've experienced some event. And I think it's really important that if you want to know how to help your child meet their milestones and how to best support them and your family in your daily routines, that you have access to that. And so that's the idea. We want to instill confidence and competence for parents every day so that you can take that worry out of parenting. I want to know what keeps you up at night, right? Whether it's your baby's not taking a bottle and you're worried about them getting enough nutrients, whether it's you're nervous about introducing solid foods to them because you're afraid of what if they choke, what's appropriate, what size should that food be? Are you online? Social media is great, but are you seeing someone in your life, their baby is maybe crawling and they're a couple weeks younger than your baby, and are you worried that your baby should be there? I want to take that worry away from you, and I want to instill confidence instead so that you have a good understanding of your family's unique path, your child's unique path, and you feel good and you feel like you have the tools to help them get there. So I've been practicing for 5 years, and my experience is exclusively pediatrics. I've practiced in early intervention, so that's families birth to 3. I've practiced in private outpatient practice, pediatrics, and I've practiced in the hospital setting, in basically any setting in a hospital you can imagine. So outpatient, inpatient rehab, acute care, the ICU units. I've done extensive training in feeding, and I've had the opportunity to work in a diagnostic clinic with wonderful other professionals. And so that timeline has coincided also with lots of people in my life having babies, which has been wonderful. But I've been seeing this trend more and more and more as my friends and family members are having babies and their kids are growing up, that they're always wondering, and they feel like they've failed somehow because their kid doesn't like tummy time. Well, you know what? They don't. Why would they, right? Sometimes that's really, really difficult, and I want parents to know, right, that you can do tummy time in other ways. It's not just putting your kiddo on the floor. There are so many other ways that we can help you enjoy that activity that's so helpful for them developmentally. It helps them get to so many other places, and to help you enjoy it. Because if you as a parent don't enjoy the activity, you're not gonna do it, because then there's a disconnect there. And we need both baby and parent to be enjoying it to support that bond. And then further from infants, when your kiddos are going to school and they're in preschool and they're around so many other peers, it is going to be really, really hard not to compare them. We're humans, that's what we do. But I've been seeing more and more this trend of worry, and they're so worried that they're doing something wrong, and I want to be there to tell you you're not. You're doing great, and this is how you can feel so confident in what you're doing. What did I do during my fellowship? So a fellowship is an advanced pediatric training through the Occupational Therapy National Association. And in my fellowship, I have the opportunity to, like I had mentioned before, I work in every area of a pediatric hospital, but then also do advanced training in pediatric feeding, which is a personal passion of mine. And I had the opportunity to engage with so many other professionals that helped me learn so many other facets of development and family life. So one family I worked with, mom and dad were young 30s, and they had just had their first baby boy, and he was doing great. And around 3 to 4 months of age, they were finding that he really didn't like being placed on his stomach. And mom and dad know this is really important to promote upper extremity strength and trunk strength and get them ready for crawling and sitting and eventually walking. And they also know it's really important for the shape of their head and their neck strength. So what we started doing was I would come over once a month, and I would show mom and dad different ways to engage in tummy time, different ways to make it enjoyable for him and for them. And eventually he started loving it, and he was spending more and more time on his belly. They were able to tolerate, as a family, longer and longer increments of time on his belly. And then eventually, here we are, 10 months old, and he's crawling, doing great. And then I stayed with this family, and around probably the typical age that babies start to go to solid foods, mom and dad were really nervous about how do we introduce these foods, what size should they be. And so during our monthly visits, would come over and kind of coach mom through, let's try this food, let's try one of these, let's cut it like this, support him in picking it up in an appropriate way that'll help him get it to his mouth. This is how we use a spoon. These are the cues that we should look for to know that baby is ready for spoon feeding, and to help them develop skills around using a spoon. And we would continue these visits through the first year and a half of his life, and just acted as a support. And with the Happy Start, they had availability to me even when we weren't doing our visits. So with the Happy Start, they were able to send me a text message or email me and have a response within 24 to 48 hours to know if what they could do differently, what was going well, or if it's something that they should be concerned about. The Happy Start is for families and parents who want to have an active role in their child's development. Parents and caregivers who want to know what their child is doing and where they're going next and how to get them there. Parents who want to who want to know the best way to support their child in their daily routine. Parents of preschoolers and kindergartners who want to know what they could be doing at home to promote their visual and fine motor skills. Parents of these younger toddlers, older preschoolers who want to know how to best help their child with self-regulation and emotional regulation. The Happy Start could be for families who are struggling bringing their kiddos out in public because of self-regulation, emotional regulation, different environments, right? So places that are new can be really hard for children, and going places out in public can be really stressful for parents. So the Happy Start can guide you, accompany you, and support you to places like the grocery store or the playground or a restaurant, and give you tools and strategies to make that a really positive experience for the entire family. So if you or your family have ever had doubts about your child's development, visit the website and contact us now to make sure your family has a happy start.